Hi, I'm Dr Ray Middleton. In this training course, my aim is to increase your skills and confidence to facilitate group reflective practice sessions. Reflective practice involves pausing to share and reflect on the ideas, thoughts, values and emotions which underlie our actions in order to develop our knowledge and skills in a continuous process of learning. Just experiencing something does not mean we'll necessarily learn from it. To learn something, we need to pause, reflect and examine it from a few different angles. It's a way to bring together and close the gap between theory and practice in order that we develop insights into ourselves, others, and improve the way we work and our confidence. Sometimes this is called experiential learning as opposed to learning just from theory, head knowledge from books. We're remembering an experience and critically examining it to say what was good about it and what could have been better. In order to develop a better understanding and skills, we need to reflect on what we're doing in the light of some theory about good practice. Some reflective learning can be done on our own, such as by writing in a reflective journal or a diary or writing blogs about our experiences. However, in my experience, there's a real limit to how much I can learn reflecting on my own. And I can learn significantly more by opening up a dialogue and reflecting with other people. This is because they can see things that I cannot see, like the back of my head. In order to develop better understanding and skills, we need to reflect on what we do and be honest about it and hear other people's point of view. There are various models of reflective practice you can choose from. Next, I'll explain a few models as this will give you a good understanding of what reflective practice is aiming at. Gibbs's reflective cycle is a process involving 6 steps. First step, description. Describe what happened. Second step, feelings. Say what you thought and felt about it at the time and now. Then the next step is evaluation. What was good about it and what could have gone better? List the positives and the negatives. The next step is analysis. How do you make sense of the experience now? Are there other ways to make sense of what was going on? This can be a good stage to open up a dialogue with colleagues and to see different points of view and different ways of making sense of the experience, because they'll bring in their own knowledge and story and understanding and maybe see it slightly differently, which opens up your mind to think, oh, I could see it a different way. Then there's the conclusion stage. What could you have done differently? Then bring up an action plan. What will you do differently in the future if you held in mind what you've reflected on today? Gibbs's model is called a cycle because the action plan in the final stage is brought back after you've tried something out, and you can do the whole cycle again, because you might come back and say, I tried something, maybe engaging with a client differently, and it's worked. Or you might come back and say, well, I tried that, but it didn't go so well, and you can do the whole cycle again. So it's a continuous learning cycle of reflection, experimenting with some learning and doing things differently, and then seeing whether or not that's made a difference. Another framework inspired by Gestalt therapy is Terry Borton's model. This uses 3 questions to reflect on an experience. What, so what, and now what? This has been adapted by various people over the years, such as Gary Rolfe. In the first stage, say what the problem is. What was my role in this? What happened? What were the consequences? Then move to stage 2 and ask, so what? What was going through my thoughts and emotions at the time? So what could I have done better? So what do I know about what happened? Now I can look back with some hindsight. What's my opinion? What are my thoughts? Then in the final 3rd stage, ask, now what? Now what do I need to do? Now what issues have been raised by reflecting on this? Now, what might happen next? They're the kind of questions in the third stage. Donald Schon's book, The Reflective Practitioner, introduced the idea of reflection on action and reflection in action. He argues professionals improvise and respond on the spot as best they can under pressure, and a bit of reflection can be done live in a tough situation. But this improvised response can be improved by reflecting in a separate space with others at a later time and reflecting on the action that took place and considering what have I learned and what could be done differently, as well as looking at the positives at the time. For Schon, professional growth really begins when a person starts to view things with a critical lens and allows a degree of doubt about our actions. To think, maybe I could have done that better. Rather than always defending ourselves, you can think of this psychologically, defending ourselves as being a perfect professional who does not make mistakes and could not possibly improve. So it's more realistic, but you're also making yourself a bit vulnerable because you're saying, well, actually, I could have done that better. Stephen Brookfield proposes that critically reflective practitioners consistently see their practice through 4 complementary lenses. So you could think of this like the lens that we look through, like sometimes people call this schema, and you can apply this to reflective practice. Reviewing practice through these lenses makes us more aware of the power dynamics that infuse all practice settings. Brookfield argues that these 4 lenses will reflect back to us starkly different pictures of who we are and what we do. The first lens he suggests we can reflect through is our autobiography as a learner. Our lived autobiography story or narrative is an important source of insight into our practice. Analysing our autobiographies allows us to draw insights and meaning and make sense of our practice on a deep emotional level. So the second lens we can reflect through is other people's eyes. Seeing ourselves through other people's eyes, we may discover that other people are interpreting our words and our actions in the same way that we intend them and mean them. But often we can be surprised by the diversity of meanings people can read into our words and actions. So this is why it's really helpful to do group reflective practice, because we can open ourselves up to other people's interpretations of what we're doing and what we think and how they read things. The third lens is our colleagues' experiences. Our colleagues serve as a critical mirror to reflect back to us images of our actions. Opening up a dialogue with colleagues about problems and gaining their perspective increases our chance of finding some information that can help our situation. And the fourth lens is theoretical literature. So theory can help us. So although reflective practice is about our practice, it's also about theory. So theory can help us name our practice by bringing some ideas and concepts to help us to make sense of experiences. So an example I'd give there would be, I might be feeling kind of worn out and lacking compassion for the people I'm working alongside. And in an open dialogue or reflective practice session with colleagues, someone might introduce the concept of burnout or secondary trauma or compassion fatigue, and they're concepts from theory that might help to make sense of why I'm feeling burnt out. And then we can open up a dialogue and think, well, what do you do to help? What can you do around self-care to help to improve when you are feeling burnt out? So there's an example of how reflective practice people can bring in an open dialogue way, ideas and concepts that may or may not be useful, and then you might add them to your lens or way of looking at the world, and then that improves the options available to make sense of experiences that we have, because they're kind of theoretically informed. It's not that all theory is true, and you want to avoid using jargon as much as possible, and I believe in speaking in plain English, but some of those theories and concepts can be really helpful to kind of make sense when we're stuck or we can't articulate and make sense of something. Finally, David Somerville and June Keeling, in a 2004 publication, suggest an 8-stage practical approach to reflective practice within nursing. If you're not in nursing, you can still apply these. So they say, firstly, seek feedback. Ask other people, can you give me some feedback on what I did? Another second stage then is to ask yourself, what have I learned today? And ask other people, what have you learned today? So you're encouraging an informal reflective practice culture to build up. The third stage then is to value and validate personal strengths by identifying positive achievements and identifying areas for growth. So validate yourself and say, actually, I've done some stuff good today, and you can say, but this is an area where I want to grow. The fourth step is to view experiences objectively by imagining the situation is on a stage where you're in the audience. Their fifth suggestion for reflective practice they call empathy, and here you say out loud when you're with someone what you imagine the other person is experiencing, their thoughts and feelings, and then you listen to their response. Their sixth suggestion is to keep a journal, record your thoughts and feelings and future plans, and look for emerging patterns. So you're reflecting on your work and yourself and as you're progressing. The seventh suggestion is to plan changes in your behaviour based on the patterns you identify earlier on in these suggestions to achieve a better future. So basically you're reflecting, you're saying here's a pattern, maybe I overwork and so I need to kind of be a bit more boundaried, or whatever you're learning about yourself, then you plan to change your behaviour based on what you've learned. So the eighth suggestion they sum up as they call creating your own future. And there they talk about combining the positive virtues of the dreamer, where you think, well, things could be better, and the realist, who's kind of very practical and saying, actually, in this context, in this service, in this job, realistically, this is what's possible. And the critic, which is able to be self-reflective and think, actually, I could do a bit better here. So your optimism is in the dreamer about things could get better, tempered by some realism about actually, this is probably realistic. And then the critic, which is, actually, I could get better at this if I open myself up to some reflective practice and learning. So there are several models of reflective practice that I've shared with you there. And to be honest, I can find some of these overcomplicated and hard to remember when I'm facilitating a reflective practice session in a group. So I tend to summarise all of these models into a simple 5-step model that I can remember on one hand. We can think about reflective practice in 5 stages. Firstly, describe some work that you've done with somebody you were trying to help. Include how you were thinking and feeling at the time. Then open up a dialogue with others to reflect on it. Introduce some theory about good practice that seems relevant to the situation. The third stage is to evaluate it in the light of some theory about good practice. Discuss and open up a dialogue about what was good about it. The fourth stage is to say what could have been better about this approach to this situation. And the fifth stage is to discuss what you would do differently to improve your skills if you held in mind what you've learned through this reflection. And this is reflective practice.